Welcome to Parents Who Think. Danusia here. Today we're tackling a subject many shy away from, but my guest today, Dr. Shahzadi Harper, is here to shed some much needed light on it. Shahzadi specialises in women's health, and she's passionate about empowering women to take control of their hormonal well-being. Let's welcome Shahzadi to the show. Hello, Shahzadi. I'm really looking forward to speaking about libido today.
Hi, Danusia. Thank you for inviting me.
It is a really rather exciting topic. I like the subject of libido, but for some it's not, is it?
No, and I'm quite excited to talk about it, considering, coming from a very good Muslim background, that I'm talking about libido and sex here. And it is, it's a tricky subject for some women in particular. And especially as we age and things change, our body changes, our hormone changes. And, life has its ups and downs and trials and tribulations. So I think one of the things that women are quite different from men, if we even take away the sort of physical functionality of the body, is a mental psychology. And I think, women have to be turned on in the brain much more so than their body. And that's what, can take its toll throughout sort of generations, and also with the hormonal changes that happen. So yeah, it's a really interesting topic.
It is. Now, I guess at a body function, kind of a hormonal function of libido, I'm curious what the oscillations are in terms of, the themes, the patterns that you see as a doctor in terms of our women's libido. What are the typical ones? Because, of course, we're not the same person.
I think typically most women would go and see a doctor or be more concerned about a low libido. I think in my experience as a doctor, there's only been a handful of times that somebody's come in saying that they think that they have too much libido. And I think it's usually more towards the time that they're in their 40s, or if, they're busy with sort of children, with work, with elderly parents, and also your body's hormones are changing. And, we know from our natural cycle, most women premenstrually feel tired, feel less energized, and libido tends to be a little bit lower. Whereas mid-cycle, you tend to have much more energy and tend to feel more sexy. And that's because evolutionary-wise, that's when our estrogen levels are peaking. We're ovulating. So we're naturally looking for a mate to fertilize our egg. Our hormones have a huge part to play. Estrogen is the sort of more dominant hormone in the sense of sort of women's well-being. But I think sometimes we forget about testosterone because we think about it just as a male hormone. But actually, we also have testosterone, and it gives us drive, it gives us energy, it gives us libido. And that also rapidly declines from our 20s into our 40s. I think one of the things is we're only really realizing more so how important testosterone is. I think testosterone now is, it's much more openly talked about and known that it will have a positive impact. And considering, as women, we don't have drugs like Viagra, or Cialis, which can help boost libido. So really, we have very few tools in our toolbox to sort of work out what we can do to improve, a woman's sex life. I mean, mood has a huge part to play, but also, hormonal changes. If your hormonal levels are sort of rock bottom, and alongside that, you may have vaginal dryness, lack of lubrication. So sex can be painful and uncomfortable. And also that desire. And often the first thing women will notice is that they tend to lose that initiative drive. So that, jumping on top of him or her drive. And so they worry that maybe their bodies aren't going to react in that same kind of way. But actually women do still retain that reactive drive, so that if they were stimulated, their bodies are going to respond. They just tend to not have that, sort of more, I was going to say Neanderthal or sort of jumping, driving initiation of sex. Yeah.
It sounds like a kind of lusty launch.
Yeah. And I think something else you mentioned was about an activated libido. So I think whilst maybe in the past your libido needed less stimulation to be activated, I think as you grow older, you probably need a little bit more activation. But that doesn't mean to say it can't be activated. And there are lots of positive benefits from sex. And I think those are the things that we need to also understand, that it improves circulation to the vagina, which, helps with the internal vaginal mucosa, and also releases endorphins. Orgasms are good. They release endorphins. They make you feel happy, improve blood flow throughout your body. So we know from a mood perspective that people who have regular sex tend to be happier. So there are lots of aspects to it, yes.
Well, I was going to ask you actually to make a distinction whether you were talking about sex and penetrative sex with a partner, or in fact, whether there are benefits, whether you were talking actually about the orgasms, orgasm, rather than which is it? Or is it both? Because I know I'm wondering. So there's probably a listener out there also wondering.
Both. I mean, I would say having an orgasm, whether it's with or without a partner, is beneficial for you from a health perspective. It improves circulation, de-stresses, elevates mood. If it is with a partner, there's also that intimacy, there's that bonding, there's a release of oxytocin, which is that hug hormone, the ones that mothers release a lot of when they're breastfeeding. So there are lots of pluses on both sides. Ideally, I think you should be able to have a bit of both if you can, because I think it's good for overall well-being. But, there's no reason not to have an orgasm just because you're on your own. And I think the other thing is, I think we think that we've only got a set amount of time. There is that thought process that maybe your sex life is over once you get to 40. But, I see a lot of women in my clinic now, because a lot of women are perimenopause or midlife women, that actually they have this new awakening for them, a liberation for them. And also they're taking charge of it more and having the sex that they've always wanted. The only things are sometimes if there are sort of physical changes because of hormones and things that can make them feel less sexy, or, their libido has been flattened because of that. And that's why we do need to sometimes go down the route of HRT, go down the route of, testosterone, localized estrogen. And, one of the other things I provide in my clinic is vaginal laser treatment. So rejuvenation, tightening, which also boosts the cells of the vagina. So I think there are lots of things that we can do nowadays to have a fulfilled sex life to the degree that we want to, and we shouldn't be held back. Yeah.
Yeah, exactly. I think it's really sad that we have almost this notion of a shelf life of libido, because I've always felt that libido is a force. It's a life force, part of it. But actually libido to me really means a verve of life.
Yeah.
And, it's well beyond our sexuality.
Libido is not about sex. It's like a life force. It's that sort of joy of living, or that energy. It's that energy, and it sort of permeates and emanates throughout all aspects of what you do, work, home, sort of just walking down the street, and that's sort of bouncing your step. I think it's that positivity that it can give you. But, it does wax and wane, and you can't always be a Duracell bunny, 24/7.
So for listeners, what are the steps that we can take, they can take, if they're feeling a bit flat in the libido for whatever reason? What would you suggest?
One of the things I would suggest is, let's just go back to basics in the sense of thinking about your lifestyle. It's not the surroundings, it's how you feel about yourself. So going back to basics and thinking about, your diet, exercise. Exercise is so good for mental well-being, for physical well-being, and trying to put those sort of patterns into place, I think are really important. And that's what I would say initially. Then think about, is there anything that can be of help to you? Are there hormonal changes going on at this point? Is it that you need a little bit of a boost or going to see a doctor? Do you need to be prescribed HRT? Is there vaginal dryness? I mean, a lot of women who are breastfeeding get vaginal dryness. Do they? Yes, because they have a huge drop in estrogen levels because of breastfeeding. So, are there any mechanical or physical changes that can be addressed? Also, funny enough, a lot of women on contraceptive pill, that can flatten your libido and it can give you a bit of vaginal dryness. I'm here, to help women to get back on track and get them to feel sexy again, get them to regain their confidence and empower them that they can, and if they want to. So I think it's really important to know that, 50 doesn't mean things are over. 60 doesn't mean to say things are over. 70, 80 doesn't mean. I've got patients who are in their 80s as well and enjoying sex. It's about how you feel, because everything has to come from the brain downwards. It's a way that you feel about yourself, about your body, about the way that you are as a woman. If you don't feel positive about yourself, if you don't like yourself, and however corny it sounds, then it's going to show, and that's what's going to hold you back. And I think, life's limited. It doesn't go on forever. So we should kind of grab it and make the most of it and take what we want, believe in yourself.
Well, it's coming back to that belief in yourself and activating that greed and selfishness and really getting to know who you are, what you want. And if you need it, getting some support to become more activated, or looking at some of those basics to see whether we're tripping ourselves up, because that's what we do as humans, isn't it? We do trip ourselves up with, sugar and alcohol and I'm going to say unsuitable sex, but not even. Well, I think we've all had certain relationships maybe that haven't worked out, and I'm talking from experience here, my own personal experience, in the sense that it's really only in recent times for me that I've felt that let's put my needs first. What do I want? And so because I'm feeling that way, that's why I want to share that with other women. I'm somebody who had an arranged marriage, so I was basically told what I had to do. And so now I very much, sort of in charge of my own destiny, and have had some not very good relationships on the way. So I think it is about sort of learning from that and respecting yourself, understanding your body, and also understanding your mind. And if you want to have sex, then you should be able to. And, your libido is an energy. It's not just about sex, I think. Oh, it's been a wonderful conversation. Thank you for this. Fantastic.
Thank you. Thank you.
Listeners, it's never too late to prioritize your hormonal health and seek support if you need it. Whether it's making lifestyle changes, exploring hormone therapies, or simply communicating more openly with your partner, there are pathways to rediscovery. Until next time, keep loving and thinking. Take care, everyone.